All right, so I'm sitting here with a good buddy of mine, Mike Kelly, and we're going to talk a little bit today about what Mike's up to, and I think it's really interesting and really pertains to a lot of people's lives as they come to Panama. Before we get into talking about what you do for work and everything like that, Mike, I'd like you to kind of introduce yourself a little bit and tell us a little bit about your background in Panama. I know you've been here quite a while, a lot longer than me even. Yeah. And if you don't mind, where'd you come from? What were you doing before? Things like that, just so people can get to know you a little bit.
Yeah, definitely. Well, first of all, thank you for doing this, and it's always nice to come and talk to you. My name is Mike Kelly from the United States, California. I've lived in Panama for about 13 years. When I moved here, I opened a medical center pretty much right away. With a partner of mine, we opened a walk-in primary care clinic in Panama Pacifico. And so I opened it and I managed it for about 8 years. And we focused mainly on it. It wasn't that we focused, but most of the patients that were coming in were expats. Expats, retired military. We had English-speaking medical staff. So they were kind of drawn to us for their healthcare. And so I really, in that time, got to learn a lot about, the expectations of Americans. Being from the States, I knew that, but
being on the other side of the counter is a little bit different.
Being here and then seeing, these Americans here that have moved to Panama, and not just Americans, Canadians and Europeans, wherever you're coming from, seeing the expectations that they have for healthcare, and trying to adapt the Panamanian way to do that. And that's really what I worked to do there. And as a result, we had so many expats coming in for the health services, to see doctors, basically anything that they needed. And it was a great learning experience for me. And did that for about 8 years, and built the business. We eventually sold it. And from there, I moved into relocation. So I saw some opportunities from my time. And
that's how I know you. That's how we met, actually, through when you do the relocation stuff. Yeah.
Because I got into what started as health relocation.
Right, okay.
Right. I had been contacted over all those years when I was managing the medical center by people that wanted to move here, but had no idea what the healthcare system here was like. And they were worried about things like, can I find an English-speaking doctor? Is healthcare even good? Most people didn't really have an idea about what is Panama. It's a lot of people think of it as just kind of like this third world, jungle. Not many people really know about Panama. So
it's a common question I get all the time, especially for Americans. It's healthcare, very centric questions that I get a lot.
Right.
A lot.
It's between getting set up with your healthcare and finding a place to live. Those are the two top issues at mind. Those are the two priorities. If you're thinking about moving down here, I need to see Panama, and decide where I want to be there. But I have all these health conditions that need to be managed, and can they even do that there? So I got all of these inquiries, and I was like, look, this is what I'll do. I'm going to set up a day to go meet doctors. I'll give you a tour. We'll do tours of all the hospitals so that you can see what's going on. And that really opened up people's eyes.
Right.
And so it just turned into this kind of business that no one was doing.
But it's a necessary niche.
It was necessary. Sure. And so all of a sudden people they're meeting with their doctors. They're seeing these hospitals. They're forming relationships before they even move here with the specialists and doctors that they're going to need. And so for me, it was just kind of like, wow, this is, there's an opportunity here, and it's really helping a lot of people.
Right.
So that really took off. And of course, after their health needs were met, they're like, well, now I need a place to live. Can you help me with that?
Right. Yeah.
Sure. So I got into real estate, and that turned into a full-blown relocation tour service. For, personalized relocation tours that I did for 5+ years.
Yeah. And you came at it. You were always very recommended. Yeah. You did a good job. You're hitting a lot of the VIP market, a lot of private stuff. I know that's how we work together a lot. So
it's it was all referral based.
Yeah.
marketing was minimal. It was mainly word of mouth.
Right.
And I think that was just because I'm from the United States, so I could relate to not only the Americans but the Canadians and these expats that are coming from different countries. And it just really kind of carried me through is that referral. Just always doing a good job.
Yeah.
And making sure that I went above and beyond, and that paid off in the end as far as gaining that trust. So that was until recently, that's what I've been doing.
Yeah. So now you've stepped into a new role, and I know we had lunch a few weeks ago, and I had no idea what you were up to, and then you sprung this on me. I said, okay, we have to talk about this more. And I said, and I think it's something that the people that are out there looking at Panama, I think they need to know a little bit more about what you're doing, because I think it's a huge thing. I think it's a huge thing that needs to be more publicized. I think more people need to know about it, because there is a need very much. So you stepped into a new role. You were offered to come in and manage some really interesting stuff. So let's hear a little bit about that.
Yeah, that came because I had a long relationship with Pacifica Salud Hospital, which is where I work. So I'm currently working for with Pacifica Salud Hospital. There are two locations, one in Punta Pacifica and the other location is in Costa del Este. Pacifica Salud is affiliated with Johns Hopkins Medicine. Okay, so right there, we're talking about a name that is recognized and trusted by most Americans.
Yeah.
Right.
Well, globally, I think that's a global name, really.
You're right. You're right. And so it not only it starts there because the Americans know Johns Hopkins, but Canadians and Europeans and all these expats that are here, I've heard of Johns Hopkins. I know about Johns Hopkins. And so expats have always been gravitated towards this hospital.
Right.
And I just happen to have a long relationship with them from when I was managing my own healthcare facility. We had created a lot of alliances with them. And so a situation happened with a certain hospital in Panama regarding military veterans. And won't get into details or name any names, but the point is that there was a void that needed to be filled, especially for the military veterans, but also for expats in general. And so the hospital, the CEO of the hospital, who I've known for many years, he approached me. We talked about this opportunity, and it was just kind of perfect timing and fit into what I wanted to do. And so I said, let's do it. And so I started to work for the hospital in November of last year. So it's been almost a year since I've been there. And what I do is I manage our services for international patients. Okay. So, there are a few different areas that covers. One is for military veterans. So U.S. military veterans have a lot of benefits that carry over into Panama.
What's commonly converted as a Canadian, I just want to clarify for everybody else, VA benefits, right? VA benefits.
Yeah, benefits with the VA. So if you're a military veteran, you have benefits, healthcare benefits with the VA. And so when you move out of the United States, you still have those benefits, but you have to register with the Foreign Medical Program. And when you do that, you're covered for all of your service-connected disabilities. Okay. So anything that happened to the veterans while they were in service, any disabilities caused during that time, are covered. But in Panama or anywhere outside of the United States, the coverage only is for those disabilities. It's not a comprehensive, overall coverage. But if it has to do with their service-connected disability, it's 100%. So it's very good.
So is the hospital on the VA disability side, are they billing back to the VA association or the VA benefit program back in the States directly, or is there any money that's coming out of the veterans' pockets and then reimbursed, or how's that working?
Yeah, that's a good question. Yeah. With the VA benefits and the Foreign Medical Program, it's 100%. Okay. The hospital takes 100% responsibility of that claim. Okay. The veteran doesn't pay anything, as long as it's connected to their service disability. In addition to the Foreign Medical Program, you have TRICARE and CHAMP VA. TRICARE is for retired veterans, it's for active military veterans. It can cover family members. It's more of a comprehensive insurance. It doesn't only cover disabilities or service-connected disabilities, it covers anything. It's
But
like
this is
normal
the type of insurance that they kind of carry over after being active service members. Then.
even when they're active.
Okay, even when they're
this
active.
is for active and retired.
But for retired, as an example, we're mainly dealing with a lot of retired people. I'm assuming. Then it gets carried over as a medical insurance. Okay.
Right. Yeah.
And the hospital's honoring that then as well.
Right. So the hospital. Yeah. When we accept TRICARE, we accept Champia, we accept Farm Medical Program. When we accept something, what that means is that we bill them directly.
Okay.
So if you're a veteran and you come in, and whichever benefit it is, if it's TRICARE, for example, you're subject to a 25% copay.
Right.
So 25% of the total, right? That's your responsibility. You know that as a veteran with TRICARE, you know that you have to pay that 25%.
So that would be the same in America.
Same in America. Yeah. No, in America, it's a little bit different. TRICARE overseas, there's certain things, but when you're talking about overseas, there's certain things that apply, like here, the copay. But anything above that 25% copay, we bill directly back
to the States.
And so that's when we say that we accept these things, that's what that means, right? And it's a huge benefit.
That's massive. That's massive for American expats. Yeah. Especially veterans, that's huge.
It's huge.
That's huge.
It's huge. And so, since we've started to accept these benefits, which basically happened around, when I started working and I got all of this organized, we're the main hospital for the veteran community. I really think that, there are a few other hospitals that do accept these, but I think the majority of the veteran community are coming to Pacifica Salud.
Right.
But in addition to the veterans, now we have other Americans. So, the retired Americans that live here in Panama, if you're over 65 or older, you have Medicare. You qualify for Medicare, which is, retirement like Social Security here in Panama. And you can enroll in a Medicare Advantage plan. Something that's really been a huge game changer for Americans that are moving here because, as one of the biggest roadblocks for retired Americans that are wanting to move to Panama or anywhere is coverage for healthcare.
Especially if they have pre-existing conditions. Yeah, it's an issue.
It's an issue. Yeah. And for many years, a lot of people have not been able to move because of this issue, right? Like, with Medicare Advantage, they extend coverage outside of the United States for medical emergencies. Okay. So it's not a comprehensive thing. It doesn't cover everything. Like if you're in the United States, you have Medicare, you're covered for pretty much anything.
Right.
Here in Panama, you are now covered. It's not that you are now covered. It's always been there with Medicare Advantage. But Pacifica Salud Hospital will direct pay the Medicare Advantage carrier.
Right.
So that's the difference. It's like
finding a facility that is set up to be able to bill back to America. That was a previous challenge, correct?
Yeah. If you had Medicare Advantage, for however far back you want to go, there was that international coverage, right? But you would have had to pay out of pocket,
right,
and file your own claim, send everything back, and so that they reimburse you, right? Well, if you want to use a private hospital like Pacifica Salud, which you probably do, you don't want to have to count on the public system here.
Right.
So if you're an American here with Medicare, you want to be able to use the private hospitals.
Yeah.
So what we did was about 8 months ago, we got set up to direct bill the Medicare Advantage carriers. And they cover medical emergencies unlimited, 100%.
Right.
It's covered. As long as you go through ER, it has to be an emergency. It's not, like I said, not comprehensive.
Yeah.
And that's been a misunderstanding that, you cover everything.
Yeah. Well, and that's why we're having this conversation. I think it's good to get the information out there and dispel the misinformation as well.
That's misinformation. And it's not necessarily misinformation. We have always been crystal clear that it's for medical.
No, but it's the rumor mill.
But that gets into the rumor mill, and then sure enough, someone's saying, "Oh yeah, they cover everything over there."
Yeah.
But you got Medicare, you're good. Yeah. I get calls, "Hey, so you guys accept Medicare?" So we always try to be very clear, like Medicare Advantage will cover you for medical emergencies only.
Right.
Right. And so but that's the most important thing.
Yeah. And it's huge as well. It's huge as well to have government-backed pension medical insurance that can get billed. You're not losing those disadvantages of leaving the States then, you know, when you're not here to retire. Yeah.
Exactly. And, you know, that they always have the option for like a planned procedure, which is not covered by Medicare Advantage.
Yeah.
You can always go back to the United States and you still have your Medicare. You're covered.
Right.
And, you know, a lot of expats, they're like, I don't ever want to go back, you know, and I understand that.
No.
But, you know, sometimes it might make sense, you know, because, you know, financially, you can go back, do this procedure, you're covered
under Medicare.
And then you come right on back down to Panama.
Yeah.
But the main concern from, you know, what I can tell you from my experience, the main concern is being covered for emergencies, because that's really what's going to hit your pocketbook. I mean, you know, if you're not, that could put you in a financially distressing situation.
Yeah.
Right. And the reality here in Panama is that primary care, doctor consultations, meeting with a specialist, it's inexpensive. Yeah. You know.
Yeah. I know when I go to a clinic, a private clinic, I'm $20 for a consult. Yeah. You know, that whatever. I don't run that through insurance. Yeah. You know. Yeah. So those costs, those things can be easily covered out of pocket. Yeah. Right. It's good. You save money by not getting insurance to cover that. Yeah. Right. If it's something that you need to do once a year, twice a year, you know, some people have a little bit more. They need a little bit more. You know, they might need to see a doctor every month. So it's really up to each person to kind of analyze, like, what do they need and does insurance make sense? Right. But it definitely does not make sense for everybody. I would say for the majority, it doesn't make sense. So if you have if there's people out there and they want to participate, for example, whether in the VA or the Medicare Plus programs, do they have to come in to Pacifica Salud and like register and sign up beforehand, or how does that work? How do they participate? Do they contact you? Do you have certain people that coordinate? Like how does that go?
Super easy. Yeah. You don't even have to go to get pre-registered. We do recommend that everyone pre-registers with the hospital. And the reason is because that way, if you show up in urgent care, you're in the system. We know you, we've already verified your coverage. So the pre-registration process for the Medicare, the military benefits and for Medicare Advantage is to verify that you have that coverage. You know, we contact the insurance companies. They tell us, yes, that they have this coverage, right? And now we have them in the system. When they show up, it cuts down that time. If you end up in the ER, time is everything. Yeah, it's not paperwork where they're trying to figure out. Yeah, you're not going to sit there filling out a bunch of forms. You get in there, we admit you, we know you have your coverage. We're not going to have to be making calls to verify with your insurance company. So it cuts down that wait time, and it's just much more convenient. So, and you don't have to come to the hospital to do that. You know, you can email us with all of the information that we need, and I can provide that. So you can. I'm going to put all that stuff at the bottom of this video so that people don't have to go and Google it. Is what we'll do. Yeah. And but the pre-registration is you email us the required documents, and that's it. Yeah. We email it in, we verify, and we get back to streamlined. You have active coverage. Yeah. You're pre-registered, or you're not. You don't have active coverage, but you know that's the idea. Right. And so it's super easy. You know, a lot of people are like, well, I don't have to go to the hospital. You don't have to come. Right. It can all be done. Now, if you want to come to the hospital and see the hospital, a lot of people, I've been doing a lot of hospital tours. Okay. You know, it's, you know, way more than I thought I was going to be doing. And you got out of the tour business and you're back in the tour business. I didn't realize that, you know, you say like, oh yeah, you can do that. Yeah. You know, you don't have to come in. No, but I want to go. Yeah. But I understand it, you know, because people want to get their eyes on this. Sure. You know? They want to come in there and they hear about the Johns Hopkins affiliated Pacifica Salud. What does that mean? What does a hospital like this look like in Panama? Yeah. And so I'm doing a lot of hospital tours, and it's, you know, but it's amazing, like the reactions, you know, when people come in, they just can't believe it. You know, it's a beautiful hospital, state of the art. You know, it's the top private hospital in the country. You know, we have all of the state-of-the-art robotic. We do robotic surgery with all the robotic equipment, imaging, MRIs, CAT scans, you name it. Right. So it's everything from ingrown toenails up to laparoscopic, blah blah blah. So, yeah, we've got a general physician on site for primary care, but you know we're a top level hospital. Right. You know, so you know the idea is that if it's for you know, anything urgent or anything that is planned, you need some kind of medical, procedure, surgical procedure. You know, we have the top accredited specialists in the country. Amazing. And And so and there's not a specialist that we don't have.
Right.
So I always encourage people that if and one thing we do is we help get you set up with your specialist.
Yeah.
I do that. One of the things that I do probably more than anything is, okay, I'll get a call, hey, I need to see this doctor. Sure.
Right.
I contact the doctors and set up appointments. Now, that's a crazy concept, especially for Canadians, man. Yeah. Tell me about, talking about Canadians, because
we're traumatized.
Yeah,
we're traumatized.
I talk a lot about U.S. expats.
Yeah.
Because, I feel there are more expats, and the U.S. expats, the U.S. government has maybe made more effort to extend benefits for U.S. citizens outside of the United States. But Canada, I haven't met one Canada that's satisfied with how things are going with the health system in Canada.
No.
And so I also manage our medical tourism program, and we get a lot of Canadians, and they're willing to come down here, and the reason is because I can get you set up in a week.
Right.
Whereas in Canada, you're waiting
6,
months?
8, 10, 12 months to see a specialist is normal. Yeah. After you wait a couple months for the referral. First you got to get in with your primary, get a referral, and then you're 6, 8, 12 months to get a specialist. Yeah. So
it's if you need something, if you have a health condition, you need surgery, a week is too long, let alone a year. So Canadians have been, they're perfectly willing to buy their plane ticket down to Panama, in a nice hotel for a week, procedure, spend the money, rather than wait a year or however long it is to get it done in the United States. And so, from what I've been seeing in medical tourism, specifically in Canadians, is that, it's something that, for one, it's a big need. And Panama's popping up on the map for that. And when Canadians are looking between these countries, you got Colombia, you got Panama, Mexico are the main three. And to be honest with you, Panama is not the cheapest.
Yeah.
It's not the cheapest.
I always say to people, it's not the cheapest here, but it's definitely the safest in Latin America.
Yeah, it's the safest country overall.
Yeah.
Right. So it's the trust thing, man. Like it's the confidence. Americans and Canadians are generally going to, when they start looking, they're gonna have more confidence in Panama than Colombia and Mexico. Especially Americans, they know, Mexico, has this issue. Colombia, Panama's safe. We use the dollar. It's a much more developed country. Panama City is a developed city, much more than most people think.
It's a first-class city, Panama City. It's amazing.
And when people see that, then Panama kind of moves up to number one, right? And so then at that point, it's like, okay, well, where do I go in Panama for this procedure that I need? Well, Pacifica Salud is usually the one, right? It's just because it's the one that they recognize. Yeah. And it's not that, we have these accreditations. We've got Johns Hopkins, which we mentioned, Joint Commission International, which is international, one of the most respected accreditations that a hospital can have, among others. But you can talk about accreditations all day. It really comes down to the reputation of the hospital. And Pacifica Salud is really backed that up. Yeah. And you can see that, from testimonials that people give. It's just it just makes sense, and it's Pacifica Salud really has become the number one kind of go-to for expats for medical tourism. We're really kind of growing in that right now. So it's been great. And
how's the hospital handling the influx of expats? Like, have they adjusted to, for example, language and things like that? Has there been growing pains with that, or has it gone pretty smoothly as more and more expats because you're good at your job, I'm sure you're bringing more people in. Yeah. So how has that transition for the hospital gone as more and more expats have come in? Has there been any hiccups or?
The hiring me was like one of the steps.
Yeah.
I don't think there's another hospital that has someone in my position that's really, because one of the things that I do and that one of my objectives when I started was to create a VIP experience for the expats. What that means is, top level customer service from the very beginning to the very end, right? And so I'm there. I'm usually in contact with most of our international expat patients. And so if it minimizes language barriers. You know, one of the worst things if you're in a hospital in another country is that you can't communicate with the people. You know, you got nurses, you don't know what they're talking about. You have no idea what your doctors are talking about. That is the worst thing, because healthcare, communication is key.
Yeah.
So the hospital, some of the steps the hospital took, they brought me in. We've also beefed up our customer service with English speakers. So even if I'm not there,
somebody is.
We have other people, you know, which is nice to have that support. You know, otherwise I'd be going crazy.
Right.
And then on top of that, all of our doctors speak English, and many of the nurses, and that's one of the big things with as far as medical staff goes. Most nurses aren't bilingual, but we've managed to get a pretty big amount, like quantity of nurses working that are. Right. And so what we do is, if you are staying in the hospital, we dedicate our English-speaking nurses to our expat and international patients. Okay. And that's, you know, that's huge.
Very accommodating.
At the end of the day, it's such an added value. Yeah. That this nurse that's coming into your room can communicate with you. Yeah. You know, and if they can't, you know, so it's not a guarantee. Sometimes maybe one of them's not available. If not, then we, you know.
But the effort's being made to accommodate. That's the point. Absolutely. And it's adjusting. It's going to be a while to get everything, I'm sure, perfect, but it's on the way.
Yeah. It's, I mean, as far as, you know, the expectation that one should have, being in a foreign country where, you know, English is not the main language. Yeah. I mean, I think, you know, if you end up in, you know, I hope no one ends up in the hospital, right? Yeah. But you know, if something happens, you end up there. I think anyone would be pleasantly surprised. And, you know, and you can see, that's where you can see that the effort that the hospital has put in, because it's, you know, you have these nurses that you can speak to, you know, and that's, you know, there might not be another hospital where that happens as much. Yeah. Yeah.
Where do you see things going in the future? Do you see expansion of programs? Has there been any talk, not making promises, but do you see there being more progress made into expanding what you guys are offering, or mainly just shoring up what's already in place?
Yeah, I think, you know, we're just, you know, and part of what I'm doing moving forward is to expand on, you know, what we've already set in place, maintain that VIP concierge level. And, you know, and that's one of the keys for me, is that concierge, you know, that, you know, providing a next level, you know, creating a family plan for the hospital. You know, it's something that I'm seeing could be more beneficial, is to have some kind of affiliation that gives you benefits at the hospital. Yeah. You know, and, you know, that goes for, you know, your consultations with specialists, discounts on surgical procedures, different things that would be benefits of a family plan.
Right. Because there's more and more younger expats coming now too. Yeah. Traditionally, we had a lot of baby boomer retirees, and over the last couple of years, me and you, we've both seen a big shift. More people our age or younger coming now. So absolutely. I think that's a good forward-looking plan.
Yeah, you know, a lot of Americans, and I'm sure Canadians, they get into these like concierge health plans, right? You know, in the United States, it's like, okay, if you pay for a concierge plan, you don't have to wait to see your doctor, right? And you can go and spend 2 hours with your doctor if you want, right? And they'll go to your house and visit you. Yeah. So those are, you know, when I think about a concierge plan, those are the things that I'm thinking about, right? Like, you know, above and beyond. Like, imagine having a doctor that, if you can't go to the hospital, they can go see you. Right? Yeah. Imagine having, you know, access to your doctor by WhatsApp, or being able to get on a video call. Yeah. Right. And talk to your doctor without having to go to the hospital. Like, these concierge level things that are common in the United States, you have to pay a lot for them. You would have to, you know, something that there would be a cost of, but much less. Right. But that same level, you know, I feel like, you know, I want to live up to the Johns Hopkins name. Yeah. You know, Americans they get these concierge plans like Mayo Clinic and Johns Hopkins. They have these concierge things with big names, you know. I think that you should be able to do the same in Panama, and you will. Yeah. So those are the things that are coming with the hospital. Right. And you know, I think, you know, just stay on top of it. I mean, you know, a lot of hospitals here, you're just kind of looking around to see what everyone else is doing. Right. You know? Instead of being in the forefront. Yeah, you know, we were the first hospital in Panama City to accept Medicare Advantage. Now there are a couple of other hospitals that do, but it took them 8 months.
Yeah.
So they probably were not even thinking about it until they saw that we were.
Right.
But it's just another perspective that I brought. Like this would be huge.
Yeah.
Right.
Yeah.
So if we can do this, and I think now, every retired American comes to the Pacifica Salud. So now these other hospitals are like, okay, we got to get on this.
Well, it's raising the bar, right?
It's raising the bar,
which is good. If everybody else does it too, amazing, because it's better for everybody.
And I never, for me, I really believe that, expats here should have multiple options. I never thought that we were going to be the only hospital that accepted Medicare Advantage. I figured someone else was going to be doing this. But, now these options are available, and it's in the big picture, that's better for the expats, right?
Yeah.
But the fact that we did it and it took so long and we were able to establish ourselves, I think it just built a lot of trust.
Yeah.
Built a lot of trust in the community, and that's hard to break.
Yeah.
You know what I mean? So, that's what I plan to do is just keep doing that.
Yeah. Well, there's lots of room to grow for sure, but like you said, as things get shored up and there's more solid services, as far as, like you said, more English speaking nurses and more concierge and more service. That's amazing.
There's always areas to improve. And that's kind of what makes it fun for me. Because otherwise I'd be out of a job, I guess. But
you got to innovate. So
it's keeping. Where can what can we do better? What can we do better for the international community here? And as long as I can keep thinking of things, and we're good. But we're just gonna keep moving. We're gonna keep doing that. We're gonna stay on top. We're not gonna get complacent.
Outside of the Canadian and the American market, have you seen any growth or more interest from other markets besides North Americans, or?
Yeah, mainly. So other Latin American countries. We've got Venezuelan patients, Mexico, that come from major surgeries. One thing I should point out, and really for medical tourism, like if you need a cosmetic surgery, you're probably not going to come to Panama, or at least not the Pacifica Salud. Cosmetic things, Colombia does that really well. And what we specialize in at Pacifica Salud are more kind of serious procedures, like a heart procedure, neuro, brain, orthopedic, hip replacements, knee replacements, brain surgery. These are things that can be the difference between life or death, or seriously affect someone's life.
Not non-elective, but serious stuff.
And so, what has really set us apart from hospitals in Colombia and Mexico is the fact that we have some of the most highly trained surgeons that do these types of surgeries, and highly accredited. And it's just when it comes to something like that and they have to choose, we've become that number one choice.
Right.
And I don't, like I said, we're probably not beating these other countries in price, because we're competing with other countries, really.
Yeah.
Like within Panama, not really, but okay, how can we compete with them? But
Panama and Panama City has its own advantages for that. That's for sure. If your family's staying in an Airbnb while you're in surgery, they don't have to worry about their safety for the most part. Other places can't necessarily say that. Or if you're here for a couple weeks, you don't have to worry about your nurses robbing your wallet, and things like that.
100%.
So that's the big advantages, I think, that I see. And I talk a little about this with my clients. Panama, the advantage here, and a lot of people choose it for safety, political stability, and running on the greenback, the U.S. dollar.
A lot of the things that we've been able to accomplish at Pacifica Salud within the last year, I have seen firsthand have pushed people over that line of, should I move to Panama or not, or can I move? It's not a should I, it's can I, right? People that want to, move out of the United States or Canada or wherever for a better life. They want to invest, right? You have people that think about investing in real estate in Panama. And at the end, if there's health issues involved, it's like, it's always, people have made it to that point and pulled back, because why would they want to invest a bunch of money somewhere where they're not sure that their health needs can be taken care of? Right? So now that's changed.
Well, when I came, I had a lot of sellers that were leaving because they got older,
Yeah.
and they were afraid that their health needs couldn't be met, and
Yeah.
so they went back to their home countries.
Exactly.
You know,
Now they-
because now that's
Yeah.
a different story with this type of thing.
It's totally changed. Those people now
Yeah.
will stay.
Yeah.
You know, and you know, I mean, if you're an American and you don't have Medicare Advantage, you can get enrolled. Like so,
Yeah.
it's that option's there, and it's opened so many doors. So
Right.
I think it's going to have an overall very positive impact in Panama. You know, as far as not only healthcare, this is something that stretches further than that. You know, you're going to have these people that want to live here that are going to now invest their money in Panama. You know,
Yeah.
that now have like these opportunities that before they didn't. So I think
Healthcare and education and safety and security, I think, are the three top things.
Yeah.
You know, and if those things are being met within people's adopted countries, I think the rest of it falls into place.
Yeah.
You know, so
Yeah.
in conclusion, is there anything that you want to kind of summarize on what you're doing, or or to convey to people as an overall message on how you're trying to help beyond what we've talked about?
Yeah, I think something that I do want to mention, and I hear a lot from a lot of Canadians, like, what about Canada? What about Canadians? You know, like you talk about Americans with Medicare Advantage, what about Canadians? It's like, don't worry, I haven't forgot about Canadians.
Good. Look, good for you, buddy. Good for you.
Look, I really want, I would love to, and I'm working on this. Trust me, as soon as it's possible, we will be the first hospital to do this. You know, to be able to accept some kind of benefit for Canadians at our hospital, healthcare benefit. You know, and so while that opportunity doesn't exist right now, I'm hoping that changes are made.
It's not being ignored, which is good to hear. Yeah, I like to hear that.
Yeah, we got to, I think Canadians, I don't know what you would do to bring this to the attention of the Canadian government. Like, hey, what about all of us expats who, we're out here and we don't have good options for healthcare.
It's a little bit different in Canada because whereas you guys have a national health Medicare system, we have a provincial, so it's fragmented into 12 or 13 things. So it's 13 governments you got to deal with, not one, and that's where it becomes difficult, unfortunately. But thank you for thinking of us.
Yeah. So my point is that as soon as I'm looking into it, I'm keeping my eyes open when the opportunity's there. Everyone will know about it.
Yeah.
And so I think that's pretty much it. I mean, I don't focus on just one group of expats or another. I try to I provide the same experience in any way that I can for all of our international patients. And it's I'm totally open for anyone that wants to come in and see the hospital, learn more.
Which is amazing to have that open door, thing. We're used to in Canada being a very closed door. You only come if you have to. So that open door thing where people can feel comfortable, I think is amazing.
Yeah.
And being able to do that. And I think this is huge. And when you told me about what's going on a few weeks ago, to me it blew my mind because it's such, I think, an issue. And it's part of, I think, Panama progressing to accommodate the changing populations here and the changing dynamics of the people that are coming and immigrating. And this is something that we all need. We absolutely all need this. And this is huge because it was definitely something that I think was a detractor before, and now it's become an advantage. So that's amazing. So you didn't do it yourself personally, but I think you were a major part of it.
Yeah. No, I don't take credit for it.
But it's amazing that you're part of it and that you're willing to come and talk to and share this. And I hope more and more people know about it so they can take advantage of it so they can have a better life here. Yeah. And that's the big thing. If everybody's happy in Panama, Panama's a happy place.
Well, coming from my background in relocation, it's, spending so much time, so many years helping people through all of these different things, that I've brought that into what I'm doing at the hospital, right? And I think it's a unique perspective on it. And, I have, real estate friends and relocation groups bringing people in. I mean, I think, that's essential when someone's trying to learn about Panama. So, I can always, that's something that I love to do. And at the end of the day, I really think that it can be that thing that pushes you over the line, where before you wouldn't. Yeah. Now it's like, wow, Panama is the perfect.
It's one more service. It's one more way to feel comfortable. It's one way to know that you're. I think that's a big thing. So, Okay, so you're gonna pass me some information. I'll include it in the bottom of the YouTube videos and the blog posts and all that stuff so that people don't have to bother me. They can come and bother you. And then you can help them out, or your team can help them out on getting set up with the hospital. That's amazing. Mike, thanks a lot, buddy, for coming on over and sharing this unbelievable development that we've had, for sure.
No problem. Anytime. Thank you very much.
Awesome. All right, buddy.
All right.
So,